So, all right, so I'm glad that you're all joining us here today for the third session of the conference. And I'm very happy that we're being joined by some colleagues of mine who we all participated in a study group this past spring about data literacy. In part, this was organized and inspired by Maricel Santos. This is a colleague of ours. Maricel and some of her students came last NGEL conference, if any of you attended that session in the spring. And Maricel was also maybe one of the last speakers that we had, plenary speakers, when we were still in person. Maricel came to our in-person conversation to talk about health literacy, and particularly around communicative justice around health literacy, to make sure that people understand ways to communicate and what their rights are when it comes to getting information about health. So the idea of these two sessions is to really dig into the idea of data literacy, kind of talk about what it means and what some models might be that our people have developed, and then to think about what it might look like to do data literacy in your own programs around the state. So just briefly, the idea of data literacy is and we're kind of talking about this in the previous session. That's always interesting how one session bleeds into the next. But so in our last session, we were talking about learner leadership, and that's really about students being proactive, not just kind of being thought of, but learners being involved in making decisions about the program, about curriculum, about program direction, and sitting on the board and things like that. And so consistent with that idea, data literacy is really about students as learners and as citizens, as residents, as people, not just passively consuming information or passively consuming data, right? But creating data, right? Taking information that's out there, gathering information that's out there, and analyzing it, and then turning it into useful data, right? So there's a difference between information and data, right? Information is facts and figures and that sort of stuff. When it's part of a question, when it's part of an analysis, then it can become data, right? So the idea is moving from just reading information, and consuming data to creating your own data proactively and analyzing it. So then with that in mind, we're going to turn to the first presentation, and Sherry's going to walk us through, kind of talk about some of the work that she's done in her programs to kind of further the discussion of data literacy and communicative justice. And then in the second session, Bonnie's going to talk about similar projects. So hopefully you can come to both. The design is so that they're going to work together, so that we can have lots of conversations that lead from one session to the next. All right. So I want to thank Janet, Sherry, and Bonnie for being here. And then Sherry, I turn things over to you.
Oh, thank you, Eric. First of all, inviting me to present here, and I am thrilled to also have my colleagues Janet and Bonnie. As Eric mentioned, we were all part of a research program, and I'm going to try and get the slides up here as best I can. So let's just see if this will work.
Yep. So far, so good.
Sherry, you're muted.
Now we can't hear you.
Sherry, you're muted.
Yeah, Sherry, you're muted.
Okay.
Oh, now we can hear you.
Okay. All right. All right. Let's make sure that this will work. Can you hear me?
Yes.
Yep, we can hear you.
Okay. All right. Well, everyone, first of all, it's a pleasure to be here, and thank you again, Eric, and I'm happy to have Janet and Bonnie here. We were all colleagues and parts of this research project. My project focused on health literacy, and just to give you a little bit of background, I actually am a trained public health professional. I've had over 10 years of experience also working in adult education with languages and I have taught both ESL, HiSET, I've taught GED, and the information that I'm going to go over is applicable to many different types of adult education programming. And so what I'd like to do is first start with some background information about health and public health and what we've all been through in the past couple of years. With that, I would like to start with concept of well-being. And well-being really entails, our well-being entails many different things. Well-being globally, over the last 3 years with the pandemic, you've heard a lot about health equity. And there has also been a lot about advocacy and a lot of information also about the connection between health and literacy. There's also been a great focus on sustainable development goals, which we're going to talk about in a few minutes, and also about health promotion, as well as the social determinants of health. Now, the World Health Organization, through their first health promotion conference, developed a charter, and turns out that there are actual fundamental conditions and resources for all of us for health, and those happen to be peace, shelter, education, food, income, having a stable ecosystem, sustainable resources, social justice, and equity. So that in order for us to improve our health, it requires a secure foundation in these basic prerequisites. So we all need all of these to really remain healthy and have well-being throughout the world. Within that charter, the focus has been on the fact that people need to be able to take control of these things, which actually determine their health, so that if we're not able to have control over those things, then we can't achieve our fullest health potential. Human rights and health are interconnected with each other, and after the horrible aftermath, or actually during the horrible aftermath of World War II, the World Health Organization, as well as the United Nations, were developed. And the World Health Organization Constitution was written, and within that, it envisioned that the highest attainable standard of health is actually considered a fundamental right of every human being, so that it is actually a human right to be able to have a high standard of health. And that right to health is actually considered part of an internationally agreed upon human rights standard. So when we look at health, the connection between health and human rights, you can see that there's many different aspects of that interconnection. And if there are human rights violations with a direct health impact, some of those can be, for example, harmful practices, arbitrary detention, torture, ill treatment, violence. Then those practices that may address things that actually determine our health, which I just listed the list from the Ottawa Charter. Those might be gender inequalities, or lacking the right to education, not having that right to education, or not having the right to adequate. Quickly go through this. So we talked about that that within the Constitution of the World Health Organization, that health is actually a complete state of physical, social, and mental well-being. And then there are also social determinants of health. And these are determinants that actually determine our health. This is for all of us globally. And some of these have to do with housing, with economics, with transportation. Education is a social determinant of health. Food supply is a social determinant of health. When we look at inequalities that happen with health and well-being, we can see a direct connection between lack of jobs or poor quality of affordable housing, not having safe neighborhoods. If there's a lack of education or poor quality education, job insecurity, all these things actually affect our health and well-being. And the United Nations a number of years ago developed their 2030 Sustainable Development Goals. These are actually embedded within the social determinants of health. And what I just want to point out here is that you will see that number 3 is good health and well-being. Number 4 is quality education. So health and well-being and education are directly connected with each other with all of these sustainable development goals. Now, the concept of health equity, which we've heard a lot about throughout the pandemic, this has been an issue, is defined as the absence of unfair differences in health status among certain population groups. And when we look at what this concept of health equity is, it relates to health disparities, which basically means these are preventable diseases or preventable unhealthy situations or preventable deaths. And this was something that we experienced globally throughout the pandemic, where we started to see that certain populations had higher morbidity and mortality rates. That means higher illness and higher death rates than others. We saw this not only globally, but right here in the United States. Now, there's been a lot of talk about who's actually responsible for health globally and who's actually responsible for it within the United States, within our own communities. Well, it's not only the health sector that is responsible, it's all government sectors, it's all sectors that are responsible. And there's this term multi-sectoral action, which has been in the news a lot, especially during the pandemic, about the fact that there's a crucial need for removing barriers and gaps so that everyone has equal access to good health and prosperity. But in order for that to happen, we need to take action on those sustainable development goals, not just globally, but even locally within our own communities. But this picture actually shows how well-being and sustainability are also interconnected with the social determinants of health we see here, with also multi-sectors, and with prioritizing what needs to happen. And you see that it's multiple sectors, not only healthcare, that needs to be working together in all governments throughout the world. The concept of health promotion, you hear a lot about that recently also, is basically is a concept of enabling people to be able to have control over their health and to be able to improve their health. And then there's 3 pillars of health promotion. One is having good policies and the governance, and then also having healthy cities. We need to have healthy environments, healthy communities where we live, and that actually all connects with health literacy. Now, what is health literacy? Well, it actually implies more than just being able to read pamphlets or booklets. It actually means being able to improve access to health information, being able to use it effectively, and being able to be empowered to make decisions. And we see that health literacy actually influences all those other sustainable development goals. If there is health literacy within a culture, within a society, within an organization, it strengthens all the other sustainable development goals. Health literacy has been determined as a key determinant of health. It's actually considered a stronger predictor of someone's individual health status than income, employment, education, racial or ethnic group. And people with low health literacy have higher rates of illness, higher rates of death. And we have seen this during the pandemic. Looking at the statistics of who had higher rates of COVID-19 across the United States, we saw the highest rates for the elderly, for senior citizens. We saw the highest rates for minorities, people that had were in Native American communities, African American communities. We saw Latino communities also highly affected, and all immigrant and refugee groups, groups that had non-native English speakers in them. So again, who's at risk for low health literacy? Well, it turns out that just about everybody could be affected by limited health literacy at some time in their lives. But the people that have the most limited health literacy often include older adults, racial and ethnic minority populations, people of low socioeconomic status, and recent immigrants or other people whose first language is not English, and then medically underserved people. At least 90 million adults have limited health literacy, and this directly connects with the statistics that we have both through the Center for Disease Control and through World Health Organization on those individuals that have the highest rates of COVID. Health literacy integrates or needs many different types of skills, and you'll see right here that the application of health literacy requires numerical literacy, computer literacy. It requires digital literacy and data literacy. Major stakeholders involved in health literacy, well, not only is it the education of health literacy, but we need adult education and literacy practitioners to be partners in health literacy. We need the public, community organizations. We need the business community. We need faith-based organizations. It has to be a multi-sector integrated approach. For individuals, making health choices can be extremely confusing, especially if you are not someone, if you're someone who's new to the United States, if you're just learning English or don't understand the healthcare system very well for various reasons. And you hear lots of different messages. There's lots of information, especially now with technology. It can be very confusing. So with all of that, I wanted to give all of you just some background before talking about my health equity project. The project that I focused on was with a group of ESOL learners that I have been teaching. They were beginners through advanced ESL learners. However, I just want to emphasize that the project that I am going to tell you about is applicable to the entire ABE community. And these concepts can be learned in ABE classrooms, high-set classrooms, GED, not just ESOL. So the objectives that I had for the students for learning. First of all, I was hoping that they would learn about health, the concept of health and equity, and then to develop their health and data literacy skills, and also to be able to interpret diverse types of information on these topics, to be able to interpret different types of graphics, percentages, numbers, and really to be able to express their communication skills and develop them, and increase grammar skills. But my overall goal with this idea was focusing on health promotion and health equity, and really being able to eliminate gaps and barriers. And then focusing on preventing disparities, morbidity, mortality through this project, and to be able to empower and educate, engage, inspire, and motivate students. What I'm going to show you now are examples of the process that I took with the students and the journey that we took together. The first thing that I did was I created a general introductory presentation discussion on the concept of health equity, and that was for all different levels of the individual activities within the classrooms. And then lastly, the students themselves develop their own action plans and recommendations. So this is the part of the presentation that I developed for all levels of students. And I showed them a series of slides about health and equity. Some of the slides that I just showed you are the same slides I showed the students. And I had a series of questions that I asked them to engage them, to be able to have conversations. One of the things that I wanted to focus on was also being able to introduce them not only to health concepts, but also to data concepts. So this slide showing examples of social determinants of health. The students and I talked about the fact that employment, literacy and language, housing are all parts of social determinants of health. And we also talked about health coverage. By doing this, the students, we also talked about how to read a chart like this. And the students were able to express their experiences with, especially during the pandemic, about lack of employment, lack of literacy with health, and just their housing situations, and some of their concerns about not having health coverage or not having access to health coverage. We also talked about lack of linguistic and cultural competency within the healthcare system. I also showed this slide, which uses a phrase here, the 6 times the impact on health social determinants are, and ask the students, what is the 6 times the impact on health? What does that mean? This gave the students an opportunity to really voice their opinions about what was affecting their health and what they experienced during the pandemic, some of their fears, some of the things they observed. But they also started telling me about things that have been happening within their own countries. And when I showed this slide, which is about non-communicable diseases, and the fact that in the lowest economic countries throughout the world, they have the highest rates of non-communicable disease, and especially for younger people between the ages of 30 to 69 years old, the highest rates of 85% of premature deaths in low and middle income countries. The students shared with me that they already knew this. They experienced this in living in their countries. Most of the students in the classes I was teaching this past semester were from Central and South America. They also told me they had experienced high rates of cardiovascular disease and other types of non-communicable diseases. So for them, it was actually helpful to be able to talk about this, and also to be able to understand what these percentages mean. And also we talked about what does non-communicable mean versus communicable. What I did is within the questions that I asked them, I also asked about their ideas about health and equity. And I showed a couple of pictures. This was one picture, which really helped, especially for the beginners. It gave them an opportunity to just look at a picture and be able to express their feelings about what they saw as the differences. But all the students, the advanced students as well, were able to identify the differences between equality and equity by just using the word bicycle to describe what the people had. And then this next slide I showed asking the students what was the difference and what between the different pictures. And they were able to tell me what the difference between being able to have freedom, which is this liberating slide here, and being able to have equity, where they saw that there was someone who still had to stand on some blocks in order to see the baseball diamond, and equality where everyone had that. But they were able to identify this. So these are some ideas that, you know, if you're trying to use health or equity within your classes or your programs, to be able to use some of these graphics to get students to open up. So that was a little bit about the presentation that I gave. And then the next part of the project that I did was I broke down activities because I was teaching both beginning level ESL students and advanced levels. I broke down the activities for each of those classes. So covering this project of health and data literacy, it was more than just one time. It was over a series of weeks. And what I did was I started out simple with number one. I just used the phrase, "How are you?" which the students knew as a greeting. And we started then to talk about their feelings, their emotions, and to talk about their health. And then from there, we started talking about the human body, and then we talked about the thermometer and Celsius and Fahrenheit. We talked about the weather, but then I incorporated that into their health so that they were able to actually have conversations about if they're having a fever, or their child has a fever, or what is normal temperature. And then there were other types of resources I brought in on communicable, non-communicable diseases, some charts, graphs, percents, which I'll show you in a few minutes. I also brought in information, and we discussed emergencies and disasters, what to do, how to prevent, how can they get help, and I brought in information on resources. Navigating healthcare systems is very difficult for English language learners. And so we did a lot of role playing on making appointments, getting prescriptions, insurance, and there's data within all of that. I also brought in information. We discussed prevention about smoking, vaping, alcohol, and drugs. It gave the students opportunities to discuss that and ask questions, and those seeking information were able to get that. And then we also focused on changing our health habits, how to have a healthy lifestyle, and focused on nutrition, exercise, and lifestyle. I'm going to show you some examples from that. And then lastly, the students created their own action plans. action plans for having a healthy life, well-being, making changes if they wanted to. And then I also had them create recommendations of well-being, both not only for themselves and their families, but also for us as a community, as for our class. The main thing was that I wanted to make the activities interactive and make it fun, and also have the students be able to feel empowered, to be empowered. And the students did research, they presented, they ended up advising with their recommendations, and they reported. So the project really took off, and I was really happy to see that the students were able to gain skills. This is one of the resources that I brought in about eating healthy and being healthy. And you can see that it has information in it, but it also has quite a bit of data that you have to have literacy for. And so the students and I were able to have opportunities to do different types of activities so that they could learn about percents and looking at graphs and phrases like 6 in 10 adults. What does that actually mean? Here's another activity that I did. It's an opportunity. It was an opportunity for students to learn about nutrition, but there were also recommendations by the USDA on percentages of fruits and vegetables, grains and protein and dairy that we all need. And so we went over the percentages, and the students actually were able to draw in those percentages. There's another activity with this where my plate is a blank slide, and they were able to practice using those percentages. This was a great opportunity for talking about numbers and exercise, and especially for students to learn about parts of the body. We actually did some exercise in the class, and we talked about doing these numbers, and the students were able to incorporate this in their action plans. Then I also brought in information about food and nutrition labels, and we talked about percentages in these and how to read them. I brought in some food, and we looked at food labels. We talked about also what's in a teaspoon, what's a calorie. Oops. And lastly, with the action plans, the students, many of them wanted to change their habits and their lifestyle after receiving and learning about a lot of this information. And so they created their own action plans for the short run, the long range, things on nutrition. They had nutrition and exercise diaries, some of them. Some of them wanted to increase their sleep or change the hours or do things differently with their work. Some of them were very proud of their social connections, but needed more family connections. So it really was wonderful. And the students actually did research on recommendations on health and well-being, and created lists for the classes. So I just want to refocus here again that reducing health disparities entails both health literacy and data literacy, and that there's a multi-sector approach. In having that approach, which you're going to hear about in the next presentation with Bonnie Taylor, we can reach closer to health equity. And this was something the students and I all agreed upon, that we felt it's time to build a fairer, healthier world for everyone, everywhere. So I just want to thank all of you, and I'd be happy to answer any questions now.
Just quickly, Sherry, not to interrupt you, I wanted to share, Michelle had written in the chat, I think these are excellent topics to build lessons around on 9 areas and how students may express themselves in the English language in practical learning. And I'd certainly echo that, and I'm sure others would.
Thank you very much, Janet, for sharing that, and I appreciate that feedback. And I just forgot to mention at the very beginning that um, I actually create and help programs, create educational programs. So I'd be happy to hear from any of you. I put my email, I think it'll probably end up being on the last slide, but if any of you want extra help with any of this, please feel free to get in touch with me after the program in the weeks coming up or whenever, or Eric, you can let me know, and I'm happy to be of help to any of you.
Sure. I mean, I think, and certainly people feel free to ask questions or chime in or thoughts in the chat while you're doing that. One of the things that jumped out at me, Sherry, is, you're talking about both at the individual level and at the community level, right? So that there's changes that we can make ourselves, but there's changes that we need to make as a society to make sure that people have more access, right? And so
That's right.
that's two, it's related, but it's different types of data, right? So the data, when you're looking at the side of a Snickers bar or like, Fruit Loops or whatever it might be, versus data about who has access, to healthcare or who has access to, preventative care, right? And so I think that's one of the things that you can talk to students about as well, right? Is not only at the individual level, but how do we make changes at the communal or societal level?
Exactly. Thank you, Eric. I appreciate so much your pointing that out. First of all, one of the things that happened during the pandemic is that the barriers that have, these are longstanding barriers, have been in existence for hundreds of years. So these barriers that have been exposed, they're not new. It's just that we're finally talking about this both globally, and these are being exposed globally and also within the United States and locally. And Eric, you just brought out the fact that we have the ability, both as individuals as well as communities, to work on breaking down these barriers. And in the next presentation, Bonnie's going to be focusing on multi-sector approach. I focused in this particular project on individuals because what I saw, from my work within public health generally focuses on populations. And so I am actually used to working in a multi-sector approach. But what happened during the pandemic was that we saw huge increases in illness and death rates in populations where they're underserved, vulnerable populations, where people are immigrants, refugees, people are impoverished, people are the seniors. And so what I wanted to do with this project was really to be able to be of help in some way to those populations. And this was one of the ways that I could. Fortunately, I had the opportunity to work with within this research project with and be participating in it, and work with colleagues like Eric and Bonnie and Janet, who I'm so pleased and inspired because all of you are working on advocacy issues. But this was a project for me that was, something that I really felt I wanted to be able to help in some way.
Sure. And one of the things that our colleague Maricel Santos's work that she's done and work that she's talked about is how do you get to that individual level of information, right? And that one of the ways that you do it in immigrant communities where people may not be confident in their English skills is to rely upon people within that community, right, who can serve as cultural and health literacy brokers, right? And so that if they're bilingual, they're bicultural, if we provide them the supports, they can go into their communities, they know where to speak to people, and they know how to speak to people about these things, right? Where like certain data will catch people's attention and certain data won't, right? And so that's where we really need to follow the lead of folks from the communities that we work with who understand how to most appropriately and effectively communicate with other folks in that in those communities.
Absolutely. In fact, one of the things I'm in Massachusetts, everyone. So I'll just tell you, one of the things that happened here in Massachusetts was that we had just people being very afraid to get vaccines, and especially in the immigrant and refugee communities. And I actually also was doing volunteer work with the statewide public health volunteer program to go out and do the help with the vaccine clinics. And eventually we had to go to like train stations, subway stops, areas within those, think of creative ways to reach out to those folks because they were afraid and they weren't getting the information. So, there's lots and lots of ways to, to reach out to these communities. I think I will just share this. One of the things that I've heard from other adult educators is that they feel uncomfortable teaching health subjects, and I understand that. I totally get that. On the other hand, this issue of health literacy and data literacy, or the lack of it, became a life and death situation that we saw during the pandemic. And so if people don't have access to this information, there were preventable illnesses and deaths that happened just because people didn't know where to go. They didn't have the resources. And so we have the ability within ourselves as educators, as administrators, for those of you who are administrating and managing these adult ed programs, to be able to support education on health literacy, on data literacy, on social justice, to be able to incorporate that in the programs is so important, because we saw during the pandemic that there were preventable deaths and illnesses that didn't have to happen just only because people didn't know where to go. They didn't have the resources. They were afraid to ask for help.
Yeah, and I think, Sherry, to that point, like, we're not social workers, we're not doctors, we're not lawyers, right? So we're never going to put ourselves in the position of answering these questions for students, right? But, as professionals, as people who speak, the language from birth, we have access and privileges that some of our other community members don't, right? And so we can orient them and navigate them towards these resources, right? Not answering their questions for them, but connecting them with professionals and folks that do have that expertise.
That's right.
I do want to call everybody's attention to two things in the chat at the moment. One is Anna talking about having a vaccine injured child, which is, I don't know, Anna, if you want to speak to that, as well as Isveldi has a comment about teaching levels or mixed classes. So I don't know if you're able to see those two pieces in the chat. Anna, I don't know if you want to. Eric, can people unmute? And
I can't see.
They can, but
I can't see.
Yeah, I mean, I think the issue with vaccines would be just like anything else we were talking about with healthcare, that you'd want to talk to people who
exactly
experts and things like that, rather than being experts in the class about that.
Right. And I guess my question, Eric, is how do we support each other and learners in formulating those questions? I mean, God knows we can't answer them, but how do we think about that in ways that, sort of common wisdom is vaccines are good, when there's evidence for some people it's not. So how do we negotiate that with care and compassion, and also, certainly saying, I don't know anything, I'm not a medical person, but I think it's important to be aware of that.
First of all, I want to just say that I appreciate all the comments. I'm not able to, unfortunately, view all the comments in the chat while I'm giving the presentation, but I appreciate all of your thoughts, and hopefully I'll have a chance to look at everything, Eric, when you send the recording. But what I want to say is, first of all, I am very sorry to hear that Anna, I believe you said, has a vaccine injured child. So what I do want to just say is that the resources that you, as educators, that we have the ability to bring into the classes are for people to be able to understand where can they get help. For example, when I teach about health in my classes, I always bring information about the clinics, the free clinics that people are able to get to or be able to go to. I also bring in information on health insurance. You know, where can they get health insurance help? And I also, we also go over 911 emergencies, what to do in emergencies. So these are basic concepts that anyone can bring in. You can get information. Some of the slides that I showed, you're more than welcome. I think, Eric, you're going to send those out. So those will be some things that you can use in your classroom. You don't have to feel like you have to have a master's degree in public health, which I have, to be talking about these things. But it's basically resources that people need, and they need information. Also, they need information about their rights, that it is a human right, that health is a human right, and whether they are documented or undocumented, whether they're native-born American citizens or not, the human rights covers them everywhere in the world, so that we all, as human beings, have the right to a high standard of health.
So one of the things that NJAL did, you know, 4 or 5 years ago, when the Trump administration seemed to be overturning immigration policies and things like that, we collected a number of resources and distributed a document that had information about people's rights and resources for people that were interested in immigrants' rights. And certainly we could do something similar when it comes to health rights and health resources. You know, one of the things that we were talking about in the session with Paul Germo is people starting from scratch sometimes when they don't need to, right? That there's people who have collected some of these resources. And it's one thing to go on the web, right? And you can search and Google and that sort of stuff, but it's also nice sometimes to still have a curated collection of things, right? Like some people that have read through the materials and vetted it in that way. So certainly if there's interest in that, I think NJAL would be responsive to that. You know, we do these conferences once a year, but if there's folks that are interested in continuing this conversation about data literacy, particularly with regards to health equity, that's something we would be happy to have additional webinars about or resources like that. So I know we've only got like 2 minutes left for this session. I dropped the link in a couple times for the PD form if you need that. But Sherry, there was one question about multi-level classes.
Oh,
I'm going to
okay.
speak to that quickly.
Yes, in the classes that I taught, I was teaching both beginner and advanced levels this past semester. The first part of this project, when I gave the presentation, it was an introductory presentation on health equity. It was to all levels. And it was something that I wanted to do because I just felt like there's just no information that I could find for language learners on health equity. So what I did was I went over some basic concepts. Some of the slides that I showed all of you at the very beginning of this talk are the same slides I showed the students. I input a lot of graphics, so picture, you know, things that people could talk about and give their opinion. But then I also had those a few slides there where they could talk about their experiences with the social determinants of health to learn about graphics, but also some percentages so that they could also share their experiences having lived in lower and middle income countries and sharing their experiences with me about the fact that they already had seen the effects of the economics on healthcare in their own countries.
Okay, great. Bonnie, you want to give a 30-second pitch for the second session starting at 2:30?
Sure. So at 2:30, I'll be talking about data literacy and more of the communicative justice part of our work. So I worked with an ABE class, and I'm going to talk about how we learned the language of data as well as the language of rhetoric, and how to we really practice how to advocate for ourselves in our communities with my class. And we used a lot of different resources and did a lot of different practice with, like, looking at data sources and creating our own data and writing testimony for our state legislation. So
All right.
join us
Thanks,
at
Bonnie.
2:30.
All right. So thanks, Sherry, for this presentation. I think it was very helpful. And thanks, everybody, for your questions and your thoughts. And then hopefully we'll see some of you at 2:30. And if not, have a good rest of your afternoon, and hopefully see you at some of the other sessions during the conference.
Thank you, everyone.